Did you know that ginger, a common kitchen ingredient, can be harmful to certain individuals? This aromatic root, lauded for its health benefits, is a staple in many kitchens worldwide. From aiding digestion, reducing nausea, to fighting the flu, ginger's medicinal properties are quite impressive. However, as with all things, it's not one size fits all. While most of us can enjoy ginger without a second thought, there are those who should approach it with caution. This video is dedicated to shedding light on certain health conditions that may not react well to ginger. Whether it's because of ginger's blood-thinning properties, its impact on sugar levels, or the way it stimulates bile production, it's crucial to be aware of these potential issues. We'll also touch upon how ginger may affect those who are pregnant or about to undergo surgery. Knowledge is power, and it's our aim to arm you with the information you need. So, let's dive into the specifics of these health conditions. First on our list is bleeding disorders. Ginger, praised for its wide-ranging health benefits, also possesses potent blood-thinning properties. Yes, you heard it right. Ginger can thin your blood. This characteristic is beneficial for many, particularly those at risk of blood clots or heart disease. However, for individuals with bleeding disorders or those taking anticoagulant medications, this quality of ginger warrants caution. Let's dive a little deeper. Imagine you are a person with a condition like hemophilia, a disorder that impairs the body's ability to clot blood. In such a scenario, even a minor injury can lead to prolonged and potentially dangerous bleeding. Now, introduce ginger into the equation. Its blood-thinning properties can exacerbate this situation, increasing the risk of spontaneous bleeding or making it even more difficult for the blood to clot after an injury. The same caution applies to those on anticoagulant medications, also known as blood thinners. These drugs, like warfarin or heparin, are prescribed to prevent blood clots in individuals susceptible to conditions such as stroke or heart disease. Consuming ginger while on these medications can intensify their effect, potentially leading to excessive bleeding. This interaction is similar to how certain foods can affect medication effectiveness, so it's not something to be taken lightly. Consider this: the effects of ginger are not merely limited to its fresh or dried forms. Its influence extends to ginger-containing products like teas, supplements, and even certain baked goods. So it's not just about avoiding a ginger root in your produce aisle, it's about being aware of its presence in your diet and lifestyle. In conclusion, while ginger is a fantastic herb with numerous health benefits, it's not for everyone. If you have a bleeding disorder, or if you're on blood-thinning medication, it's crucial to consult your healthcare provider before consuming ginger. Remember, it's always better to be safe than sorry when it comes to your health. Next up, we have diabetes. Now, this is a condition that affects millions of people worldwide, and managing it effectively often involves a delicate balance of diet, exercise, and medication. Ginger, a common ingredient found in many kitchens, has been praised for its multitude of health benefits. One of these benefits includes its potential to lower blood sugar levels. This might sound like a great thing for those with diabetes, right? Well, not so fast. While it's true that ginger can help control blood sugar levels, it's essential to understand that it's not a one-size-fits-all remedy. In fact, when combined with diabetes medications, the blood sugar-lowering effects of ginger can be too powerful. This can lead to a condition known as hypoglycemia, where blood sugar levels drop dangerously low. Symptoms of hypoglycemia can range from mild, such as feeling shaky or hungry, to severe, like experiencing seizures or losing consciousness. It's a serious situation that requires immediate attention. So what does this mean for individuals with diabetes who want to enjoy the benefits of ginger? Well, it's all about balance and careful monitoring. If you're considering adding ginger to your diet, it's critical to first consult with your healthcare provider. They can provide guidance on how to safely incorporate it into your meal plan without risking a hypoglycemic episode. Also, if you're already using ginger, it's essential to monitor your blood sugar levels closely. Pay attention to how your body reacts and adjust your intake accordingly. Remember, everyone's body is different. What works well for one person may not work as well for another. Hence, it's important to listen to your body, take note of any changes, and seek professional advice when needed. Ginger has many potential health benefits, but like any other food or supplement, it's not without its risks. Knowing these risks and how to manage them is key to safely enjoying the benefits that ginger can offer. Therefore, individuals with diabetes should monitor their blood sugar levels closely when consuming ginger. Moving on to gallstones. You might be wondering, what's the connection between gallstones and ginger? Well, it's all about how ginger interacts with your body's digestive system. Ginger, celebrated for its digestive benefits, stimulates the production of bile. Bile is a digestive fluid produced by your liver and stored in your gallbladder. It helps in the breakdown and absorption of fats in your diet. Now, if you have gallstones, this is where things get a bit tricky. Gallstones are hard particles that develop in your gallbladder. They form from excess cholesterol or bilirubin, a waste product, in your bile. When you consume ginger, the stimulated bile production can cause these gallstones to move around, leading to a gallstone attack. This can result in severe pain and other complications like inflammation and infection of the gallbladder. It's also worth noting that while some natural remedies might suggest ginger for dissolving gallstones, there's no scientific evidence supporting this claim. On the contrary, because of the potential risks involved, consultation with a healthcare provider is highly recommended before consuming ginger, especially if you have gallstones. Understanding your body's unique needs and responses to different foods is vital for maintaining good health. So, if you are dealing with gallstones, it's advisable to be cautious with ginger. Pregnancy is another condition to consider. When carrying a new life, it's crucial to be aware of the things we consume. Ginger is no exception. While it is known for its nausea-reducing properties, which can be particularly helpful in easing morning sickness, there's a flip side to the coin. High doses of ginger can pose a risk, especially during the first trimester of pregnancy. Studies suggest that consuming excessive amounts of ginger may increase the risk of miscarriage. This is due to certain compounds in ginger that can cause uterine contractions. It's a delicate balance, as low to moderate amounts of ginger can provide relief from pregnancy-induced nausea and vomiting, but too much can potentially pose a risk. It's also worth noting that the safety of ginger supplements during pregnancy is not well established, and the concentration of ginger in these supplements can vary greatly. Therefore, it's always a good idea to err on the side of caution. So, how much ginger is considered safe? The general recommendation is not to exceed 1 gram of ginger per day. But remember, this is a guideline, not a rule, and individual tolerances can vary. The bottom line, pregnancy is a special time that calls for special care. While ginger can offer some benefits, it should be used cautiously. Pregnant women should always consult their healthcare provider before using ginger. After all, it's not just about your health, but the health of your little one too. Lastly, let's talk about surgery. As we've mentioned before, one of ginger's many benefits is its ability to thin the blood. This property helps in promoting healthy blood circulation and preventing clots. However, this very attribute can become problematic when it comes to surgery. When you undergo a surgical procedure, your body's ability to form clots is crucial. Clotting is your body's natural defense mechanism to prevent excessive bleeding. When you have a substance like ginger in your system, which is known for its blood-thinning properties, it can interfere with your body's clotting process. This can lead to an increased risk of bleeding during and after the surgery. In addition, ginger can affect anesthesia. Anesthesia is a critical part of most surgical procedures. It helps to numb the pain and keep you comfortable during the operation. However, certain substances, including ginger, can interact with anesthesia and affect its efficacy. This could potentially lead to complications during the surgery. Therefore, if you are about to undergo surgery, it is important to inform your healthcare provider about any supplements or herbs you may be taking, including ginger. They may recommend that you stop taking ginger a couple of weeks prior to your surgery to ensure it is fully out of your system. This will help to minimize any potential risks or complications during your surgery. Remember, while ginger has a multitude of health benefits, it's not suited for everyone. It's always best to consult with a healthcare provider before starting or stopping any supplement or dietary change. They can provide personalized advice based on your individual health needs and conditions. So if you are about to undergo surgery, it's best to avoid ginger. Your safety and well-being always come first. After all, the goal is to optimize your health. And sometimes that means knowing when to skip certain health supplements, even those as beneficial as ginger. To wrap up, we've discussed the potential risks of consuming ginger for those with bleeding disorders, diabetes, gallstones, or those who are pregnant or about to undergo surgery. This isn't to demonize ginger, but to highlight that even natural remedies can have side effects. If you fall into any of these categories, please consult with a healthcare provider before adding ginger to your routine. Remember, when it comes to health, it's always better to be safe than sorry. Until next time, take care.